as we just heard, when Gerald was talking about investing in communities of color, women of color, you are oftentimes first one only woman of color in many of these rooms, sometimes making these decisions. What are some of those examples, or one example that you have seen is a bright spot in this conversation?
If you had the privilege to live in America during the pandemic, despite many of the challenges that were experienced, we did have abundant vaccine. It was developed using mRNA technology that was, created here in my home city of Boston, driven by a very vibrant biotech private sector that developed that vaccine within weeks. And it was then distributed through private companies, one of which I happened to run at the time, which was CVS Pharmacy. And most Americans lived within 5 miles of a venue. And apart from the initial weeks where there were some shortages, if anything, what actually happened was that we expected people to resist taking the vaccine because of distrust of the healthcare system, traditional inequities, for it to break along race. And the community leaders came in and worked with us to support that and to drive it within their own communities. And that is a clear learning, which is you cannot drive these outcomes without communities and leaders one zip code at a time. Instead, it actually fell along political lines, and there turned out to be resistance for different reasons. Mm-hmm. But it was probably, I think, one of the best examples that we will ever see at scale of public and private working together.
So Neela, what would you like to see the forum doing or executing that takes our impact to the next level?
I really think the issue is we don't have integrated care systems and we don't have community health. And actually, very few people are incentivized to deliver community health because the way our system works is that the life is not kind of owned for, an average commercial life is like 3 years. So, me stopping you getting diabetes 10 years down the road is not incentivized, right? So I think the magic wand is clearly, how do we create integrated care systems that work financially for all different parties so that they're not competing and that they can really deliver this care within the community?